What's the best pain relief that I can get right now? And if I need to take something, how much do I take and what do I take? And what's the difference? These are common questions we get when people first come in with their pain and injuries. Today, we're going to talk about what your options are and what the differences are between the different pain relievers to give you a better idea how to help yourself. Hi, I'm Dr. Gray, and today we're talking about pain relievers and what you need to take or what you can take, or should you take anything for your condition or injury. And of course, everything is going to be based on our triangle of health that we talked about. We talk about a triangle of health that's based on having good structure, good nutrition, and good mental health. And it has to be sustainable. So the first two, when people come in and they have pain, the big ones that are always on everybody's mind usually is acetaminophen or ibuprofen, right? And some people know acetaminophen is Tylenol, and some people know ibuprofen is Advil. How are they different? The ibuprofen will work everywhere in the body. It works on all your pain. So if you have inflammation in the knee, it'll work on that inflammation in that area, as well as the brain. And where the acetaminophen tends to work primarily on the brain itself. So it's more of a fever reducer, inflammation reducer, or pain reducer, sorry. And then this is known as Tylenol. This is known as Advil. Now, how much can you take? Because we hear stories all the time that these can have definite side effects. Well, we're going to get into that a little bit today. We're going to talk about, we have to remember when you hear numbers and we read something online, one thing I always want to make really clear is there's assumptions being made. Assumptions about your health, about your weight, even about your ethnicity, because these medications we're going to talk about today are required to burn off through the liver, and different ethnicities will have different levels of enzymes in their livers. So just keep that in mind and pay attention to your body, and don't get too caught up in what the numbers are unless you're going over. Okay, so what's a low dose? A low dose is in ibuprofen is considered up to 1,200 milligrams. 1,200 to 2,400 is what we're going to call high dose. And if you're using the naproxen, which is the time extended version, anything that's Advil, some of those Advils are time extended versions as well. Anything that's a time extended version of the ibuprofen is going to be lower. It'll be more at 1,000. Those are your high doses. What can change that? Well, we'll come over here. The caveat is if you don't have any, those doses are based on these things, that you don't have any kidney problems, that you don't have any stomach problems, no type 2 diabetes, no stomach ulcers, overall health is good, and no cardiovascular problems. If you have any of those issues, these are areas that these medications can affect, and you would want to alter your dose accordingly if you take it at all. Okay, so let's come over here. How do you know if you're getting too much of these medications? We'll take this off. Complications can be, you start having some kidney issues, high blood pressure, which is interesting enough because high blood pressure can cause headaches, which is what a lot of people take these for in the first place. Difficult breathing, irregular heartbeats, pounding in the ears, or impaired hearing. So if you're starting to notice any of those, and you're on these medications on a regular basis, then you might want to start considering decreasing your dose or altering your dose or finding better options, or talk to your doctor, okay, for better options. Things that can decrease the ability even further is using alcohol, medications, as we talked about, because your liver has to process these things. If you're on other medications that are taxing the liver, it's going to be diminished, and some diminish more than others, but you just want to be aware that if you're on those, that can diminish your ability to handle dosages or safely. Ethnicity, and we talked about illness here. Now, other people may take meloxicam over the counter. That's known as Mobic. That's another NSAID. That's actually similar to ibuprofen. It's just a little more, it's stronger. and you'll reach your side effects a little quicker. Aspirin's also another NSAID as well that'll have these effects on you. Things you can do naturally, if we steer you towards something naturally, that'll help you a little bit. There's things like these proteolytic enzymes. What they do is they go in and they basically digest the proteins that cause the inflammation cascades, and it'll help you with that. They're not a pain reliever though, so if you're looking for a pain reliever, that's not going to be your solution. But sometimes pain's coming because of the swelling and the pressure on the nerve, and that'll help with that. There's other anti-inflammatories, and there's natural muscle relaxants as well that you can take. But I hope this helps today. Just kind of I know a lot of you might be on these medications, and things to keep in mind and what to look for as you do these things. Of course, the number one thing to keep our health is to do something that's sustainable. And if it is a structural issue, the number one thing is always to get that structure corrected, and then you won't have that irritation or inflammation. And even with headaches, that it can be a big contributor. A lot of people are worried about risk. Since we're talking about risk here today, well, what's the risk of getting an area adjusted? I looked up a review on PubMed today, and it's called the Risk Assessment of Cervical Manipulation versus NSAIDs for the Treatment of Neck Pain. And I'm not going to bore you with the whole study, but essentially the bottom line of it was, as a conclusion, is the best evidence indicates that cervical manipulation for neck pain is much safer than the use of NSAIDs by as much as a factor of several hundred times. There is no evidence that indicates NSAID use is any more effective than the cervical manipulation for the neck pain. So what they're saying is your risk is much lower getting adjusted, and the effectiveness is no less. In fact, in many cases it's more, especially if it's something that needs corrected. If you have any questions about this, feel free to give us a call, 208-854-0600.